Hi, my name is Lisa Blythe and I'm going to talk to you about trigeminal neuralgia type 2, also called atypical facial pain, tic douloureuse, which means painful tic. So what is it, what causes it, and how do you treat it? I am not a doctor, so this is my own opinion. If you're on any medication, please don't stop taking any medication or undertake any treatment without talking to your doctor. So I've been living with trigeminal neuralgia type 2 for about 17 years. And that first happened when I was about 36. And so what is it? I just want to explain so there's no confusion what I'm talking about. The first time I had this most horrific facial pain, and you'll see in most books people describe trigeminal neuralgia as an electrical kind of pain, like being hit with a taser. And I think that doesn't even come close to describing the pain. So here's my attempt at description. Imagine a heavyweight boxer punches you in the face as hard as they can. Then imagine that they have a knife poking out through their knuckles, which cuts you when they punch you. Now imagine that knife is electrified. So they are punching you with a sharp electrified knife. It's forceful, it's violent, it's burning, electrical stabbing kind of pain. And it's so precise, you can feel it travel along the whole nerve. If someone had given me a pen to mark the lines, I could have marked the exact lines of where that nerve was as I felt it searing across my face. It almost felt like you're going to be knocked over with the pain of it. Then you read, oh, it only lasts for 1 to 2 seconds, and you think, oh, that's not much. But imagine you hold your finger on a hot stove. You touch it, you take your hand away within a split second, 1/10 of a second, 100th of a second, but you wouldn't be holding it on a hot stove, counting 1 and 2 and when you think of it like that, you've got this horrific pain, 10 out of 10 on the scale of pain, where 10 is the worst I could imagine, and that's what it feels like. That happened a couple of times, and I went to the doctor to find out what was going on, but that continued for the next 3 years for I probably once a day, most days. Occasionally I'd have it twice a day. Absolutely horrific. And it's like living with an intruder in the house. You don't know when it's going to happen, and it wears you down. But on top of that, with the atypical facial pain, you get a secondary kind of pain. So it is more of a crushing, it's still burning, but crushing, not quite headachy, but squeezing pain on one side of the head. And different to a migraine or sunstroke or something like that, it's not relieved with Panadol or codeine, not relieved by drinking water or lying down, and that would go on for anywhere from minutes to hours, 5, 6, 7 hours a day, and that would come on and off for months at a time. Then it would abate for a little while, and then it would come back. And that for me, I would rate that pain probably between 5 to 7 out of 10. So not as severe as that lightning bolt sharp sort of pain, but that it's wearing. And you read things on the internet like what might cause it. I think I've written down a few things. People say gentle breeze, sunlight, light touch, and so you think, oh well, better avoid all those things, and it really impacts your daily living. Of course, those things weren't the cause, but it's really hard when you don't know and there's not a lot of information out there. You try and avoid those things. It doesn't feel pleasant to have someone touching your face, and so I thought that I was coping okay until my 10-year-old daughter at the time said, "Mummy, why are you angry all the time. And I looked at her and I really felt sad, and I said, I'm not angry, I'm in pain. And it's a pain that people don't see, except for when you get the sharp pain. It can cause a tick in the face, so you get like that little cringe, but it's probably not noticeable to most people. So you're living in fear, it's really affecting your quality of life. So for me, I went to my doctor, was sent to a neurologist, and he looked at me as I was only 36 and said, well, it might be caused by multiple sclerosis. So I had a brain scan and an MRI, and both came back negative. They're looking for a demyelinating condition that on the nerve that may be causing the trigeminal neuralgia. That was negative, which was relief. And then they were also looking for another cause of trigeminal neuralgia, so I'm told, and if you can read about it, Google it, whatever, is that if you have some other structure next to the nerve, particularly where it comes in the region behind the ear, sort of skull area, that if there is a blood vessel or something rubbing against it, that can trigger the trigeminal neuralgia. So a surgery can be done to sort of separate those structures. And the MRI didn't show any such cause in my case. So I said, well, what's causing it? And the neurologist said, well, he said, well, you have atypical facial pain. And I said, well, he said they didn't know what caused it, but they can offer an off-label drug for it, which was a anti-epileptic medication. And I was young at the time. I wasn't sure if I wasn't going to have any more children. I didn't want to have medications that were going to have side effects such as drowsiness or affect the way I was going to bring up my other children, and had side effects, and that wasn't actually going to treat the cause of the problem. So for 3 years I lived in horrific pain until I stumbled across, accidentally, something which helped me incredibly. So, I'm not selling anything, I'm not recommending any supplements, but I'm just trying to share what helped and what continues to work for me. It's not a cure, but lifestyle changes which have made a huge difference. So part 2 and 3, I really hope that will be helpful to you. I have been able to help one other person successfully treat them using my method, which I'm going to call the Blythe Treatment Method. If you would like to use this information for research, please do so, but I just request that you call it the Blythe Treatment Method, and let's move on. All right, so what does cause it? Let's have a little look at, first of all, the Atlas of Human Anatomy. Thank you to Frank Netter. Just so we can show you, here's a picture of the trigeminal nerve. It has 3 branches, so it can affect your down on the chin, lower jaw, along the nose area, and up around the eye, but also in this sort of area around behind the ear. Okay, so that's just a rough idea. And for me, I am affected mostly in the middle section and the lower section. What I forgot to say, when I had that long crushing and burning pain, one other thing that was notable was that it was like someone had drawn a line down the centre of, down my midline, and only one half was affected. And it was most noticeable like in the roof of my mouth, like one half of the roof of my mouth felt different to the other, was in pain. Yeah, interesting. And anyway, so what causes it? It is a referred pain. Now, this is my opinion based on the great work of some other people. I'll just go and get this other book. My heroes, Trigeminal and Simons. This is the Myofascial Pain and Dysfunction, the Trigger Point Manual, Part 2. Now, I thought that I was just going to have to live in pain forever, and I had coincidentally had some pain in my foot, which some heel pain, and I'd been to my podiatrist and I had orthotics and I did some exercises and was still in pain. So I went to a new podiatrist who said, well, would you like to try some dry needling? And I said, what's that? She said, it's sort of like acupuncture, but where acupuncture is based on the Chinese style of traditional medicine, this it uses the same fine needles, but you're focusing on little tight bands of muscle. And I said, okay, if it's let's give it a try. It's low risk, not very low cost. So we had a go. When she put the needle into one specific section in my leg, I said, I can feel that in my face. And I thought, this is really strange. And it was almost like, it was not the sharp, horrific pain, but in the same section, but a very faint version of that pain there. And it felt like it was dissolving. That's the only way I can describe it. I had that treatment once a week for 6 weeks. And by the end of that the sixth session, I had almost no pain in my face at all. And I thought, wow, I'm cured. But I wasn't cured. The pain came back, but never as severely, and the same with the aching secondary type of pain. So let's talk about the trigger point therapy. And there's 3 parts to the treatment plan. But the first most notable revelation is from Trigeminal and Simons, and what they discovered. What they discovered is that these guys were fabulous. They mapped the entire body by putting needles in, and they were actually injecting, I'm not sure if it was saline or something, into the trigger points, and mapping for many different patients, if they touched a certain trigger point, where what areas of pain were affected by certain trigger points, and they mapped it out for the whole body. So, for instance, and you can see in these, you can see posters and a lot of physios and podiatrists and people who specialise in trigger point therapy show you. So, for instance, if they've got a trigger point here on the lower leg, they might say, well, it relates to referred pain here, or this trigger point relates to referred pain on the heel. But what they said was that with one particular point on the soleus, so the soleus is the muscle behind your main calf muscle, the gastrocs. People normally notice the calf muscle. The one flat muscle behind that called the soleus, which is a bit deeper. If you touch this trigger point, they said in a couple of cases, people had pain in their face. Now, they didn't say it was trigeminal neuralgia or could use it as a treatment for trigeminal neuralgia. They mentioned it. So I rushed down and bought their book, and I was so excited about what I was learning, I actually signed up and became a podiatrist. So 4 years later, by the way, I'm not a doctor. In Australia, podiatrists are allied health. We study for 3 or 4 years, depending which course you're doing. Because I wanted to learn more about how to heal this facial pain and the relationship between the lower limb and the referred pain pathways. I was shocked to find that podiatry doesn't have any teaching on how that pathway in the leg relates to the face. So now let's move on to part 3, the treatment plan. What can you do to help? I don't want to mislead or give any false information. I am not a specialist in trigeminal neuralgia by any means, and I'm a retired podiatrist, and we did not learn this. This is information I've learned over the last 17 years of living with this pain. what has helped me. All right, so pop that book down. All right, so there's a 3-part program. I realised when the pain came back after that initial excitement of being pain-free from the trigger point therapy, I thought, I'm silly. If I'd had a heart attack, you don't just have major heart surgery and go back to living your life exactly the same way. You have to work out what causes the heart attack so that you can then improve your lifestyle. Same thing with the referred pain in the face. Something was causing that trigger point to be aggravated. So I kept a pain diary. So you write down when you had the pain, what causes it. For me, well, now I know that the soleus, that point in the lower leg and the lower calf, was where the pain was emanating from. So there were a few different things. The main one was I used to put my foot up on a footstool. It was a really firm foam footstool with a sharp edge. It was almost as hard as just a coffee table, if you like. And I would rest my foot on the leg, on the lower leg, where that trigger point was. In fact, the pain had started not long after we'd got the footstool. So I immediately stopped using the footstool. I also looked at my posture. So you can imagine, I'll just stand back for a minute. So if you've got pain in the lower leg, if you've got bad posture, if your knees are rolling in, or they're particularly out, or something like that, and that's going to affect the muscles in the lower limb. So by wearing the correct footwear, and it doesn't mean expensive, it just means the right shoes for you, that is going to make a difference to reducing. We want to try and reduce anything that's going to cause this pain. So I got better footwear. The other thing, I stopped using the footstool. I noticed that the pain, what other activities did I do that caused the pain? So knowing what I did now about the muscles in the lower leg, that I realised certain activities such as kneeling. So if you're doing some gardening or cleaning the floor or something like that, can put a lot of stretch on that nerve. So it's irritation of the nerves in the lower leg all extend from the sciatic nerve. So certain things will make it worse. So if you're sitting up in bed, for instance, and you're sitting up straight and you have your legs out straight, you're putting great stretch on that nerve. And by doing something as simple as bending your knee, and I have seen other people, another person who was affected, who did that, had the knee bent, you're immediately taking some of that stretch off the nerve and the irritation off. Another time I got pain, the sharp lightning bolt type of pain, was when I was driving the car. I'd get, as soon as I hopped in the car. Now in Australia, I've got an automatic car, so I'm driving, pushing my right foot on the accelerator, and my left leg, I'll try and show you here, I would just sit on the car seat, and this one's driving. This one, I've got it tucked up, and I did it without even thinking about it. I'm tucking it up, I'm putting pressure on the calf. So anything that, whether it's crossing your legs or whether you're sitting like this, or think about what are you doing that is going to make that pain worse. What are you doing to irritate or cause scar tissue or discomfort in that lower leg? So that's, yeah, what doesn't cause it is sunlight and air and all of those things. Shingles in the ear, even though the pain sometimes I get like a sharp, like a red hot poker in the ear kind of thing, because it's irritating that section of the nerve which is right near the auditory canal. It wasn't caused by shingles. It's not caused by toothache, temporomandibular joint pain, all of those things. It's in my personal opinion that it's all just referred pain from that area of the muscle in the lower calf. So so the treatment, in terms of treatment, I would recommend that you see either a podiatrist or a physiotherapist or someone trained in trigger point therapy. If you can say to them, I have the trigger point in the soleus, they will actually be able to palpate it. They'll be able to touch and feel it, and you will know because it's painful in that section when they run their hands over it, and they can use the correct needles to do that. If the person hasn't heard of trigger point therapy, find someone else. You can also use, once you've had it done with the trigger point therapy with the acupuncture needles, you can do things like use a spa, jets to help with the trigger point, but it's hard if you don't know where the area is that's called, where the pain is. The other thing I would recommend is if you've got other sensitive trigger points in the lower limb, have them treated as well at the same time. And the person treating you, clinician, should check for other areas that are painful, and they can palpate those, they can feel them. And the reason for that is that if you've got one area of tightness and they're out of balance, you want to release any areas of tightness. So the second thing is to watch what you're doing in terms of pressure you're putting on that lower calf. The other thing is going up and down stairs can sometimes cause an issue because you're just taking that first step up or down can contract the calf muscle, and even wearing tight socks, really tight jeans or things, pants, those things can cause the trigger point for me. So you've got your lifestyle things, you've got the trigger point therapy, and part 3, and this one's really important, is one exercise. It takes perhaps a minute. I would do this once a day for the first 6 weeks, and whenever I get a flare-up of pain, I go straight back to that exercise, and it's fantastic. So some people call it a neural stretch or nerve stretch or a flossing of the nerve. There are different approaches. This is the one that works for me. The reason, if you would imagine your nerve is like it is running down the length of the leg, and we don't want it to be caught on any little bands of fibre or muscle. We want to gently move it. So you imagine that you're gliding that say this is the nerve in the muscle, and just gently encouraging it to move and not have any tight areas. If this exercise is uncomfortable or causes any pain or discomfort, please stop and see your doctor. I'm going to talk through the exercise as I do it. Let's have a look. So I hope that this back and forth isn't going to drive you mad. Okay, so you have to be sitting in a chair that's firm, such as a dining room chair, something like that. You need to sit up really straight, shoulders lowered, looking straight ahead. Step 1 is we're going to lower our head down so our chin is on our chest. This is important. If you lift your head up during the stretch, it won't work. So I'll just have my head up while I explain the rest of it, and then I'll show the whole thing with my head down. So then we're going to have the arch of the foot. We want to roll the foot in as if we're trying to press that arch of the foot here onto the ground. So let me demonstrate. So so step 1, I'll have my head down. I'll have the foot rolled in. We're just doing one leg at a time. And then I'm going to slowly lower that foot, keeping it in that position, and then I'm going to wave it back and forth 10 times. I lost count. 7, 8, 9, 10. And now, keeping my head down still, I'm going to try and lift my leg up a little bit higher, and I'm going to wave it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now I can lift my head up and the stretch is no longer working. Lower that leg. So we want to do it both sides, even though, so I forgot to mention earlier, the pain is ipsilateral, which is a fancy word for saying if you've got the painful or the trigger point on the left side of the leg, then it's the left side of the face. Similarly, on the right side of the leg, if that's the one affected, that will affect the right side of the face. But we always do both legs just for symmetry, and it's really a good idea, particularly because if you've had pain in one leg or discomfort, often we then start walking improperly. We're trying to protect it, and we can cause the same issue happening in the other leg, so we don't want that. All right, so there are 3 things. I hope it really helps. So go and see someone about some dry needling, think about not causing any pain or pressure on that lower calf, and thirdly, doing that exercise once a day. And just for fun, one last thing, you want more? A twin study perhaps? It just so happens I am an identical twin, and my identical twin sister does not have or has never had trigeminal neuralgia. Now that's only one case study, but I hope that this helps you and to live a pain-free life. I don't know that this will help people. I don't think it will help people if you've got the trigeminal neuralgia is caused by multiple sclerosis or other demyelinating condition, or if you have trigeminal neuralgia caused by something rubbing against the nerve, say another blood vessel. But this is a low cost, low risk exercise, lifestyle change. It's not going to hurt you to try it, but I think it's unlikely that it will help in those situations. But I don't want to give any false hope. But for those with referred pain, I hope this has been helpful to you. Thanks very much.